Here is a weight chart for girls. The child's age in months is along the bottom of the growth chart. The child's weight is up the side of the chart. There are 5 curves on this chart. The line labeled 0 in green is the median, which is, generally speaking, the average. It is also called the 50th percentile because the weights of 50% of healthy children are below it and 50% are above it. Most healthy children are near this median curve, either a little above or below it. The other lines, called z-score lines, indicate distance from the average. A point or trend which is far from the median, such as above 2 or below -2, usually indicates a growth problem. The growth curve of a normally growing child will usually follow a track that is roughly parallel to the green median line. The track may be above or below the median. A child whose weight for age is below the -2 z-score line, 4th line from the top, is underweight. A genetically or naturally small child may be near this curve but still be growing well. The bottom line, -3, indicates very low weight for age or severe underweight. A child near this line is probably not healthy and needs attention. Note that a baby's birth weight is an important indicator of health. The average weight for full-term babies, born between 37 and 41 weeks gestation, is about 7 pounds, or 3.2 kilograms. Newborn babies may lose as much as 10% of their birth weight. Although many babies lose weight within a few days of their birth, they soon begin to put on the ounces, so do not worry if you see a slight decline in the weight of your child right after they are born. Here we have a growth chart for boys that shows the curves of 3 children who were weighed regularly. What can we tell from looking at these charts? Remember to look at the overall shape of the growth line. The growth lines on the chart show a similar shape to the standard curves. However, each child is growing along his individual path. Notice that they all had different weights from the beginning. A child may grow more at one time than another, so there may be small ups and downs in the line. Therefore, it is important to look at the general shape or trend. Here we have a growth chart for John, who is 9 months old. What do you think of John's growth? John grew well for the first few months, but has not grown at all in the last 3 months. Some questions you might want to think about. How was John fed for the first 6 months of life? What milk does John have now? What feeds does John receive now? How often does he eat? How much does he eat? What types of food does he eat? How has John's health been over the past few months? You might find out, for example, that John was exclusively breastfed for the first 6 months of life, and that his mother is still breastfeeding him frequently by day. He sleeps with his mother at night and breastfeeds during the night. At 6 months, his mother started to give him thin cereal porridge twice a day. John is only receiving 2 meals of thin porridge twice daily. He needs more frequent, nutrient-rich complementary foods each day, now that he is over 6 months of age. We will talk in more detail about complementary foods later in the course. Here we have a growth chart for Kate, who is 3 months old. What do you think of Kate's growth? She is gaining weight too slowly. Kate is well and a good baby who cries little. She only wants to feed 4 to 5 times each day, which her mother finds helpful as she is busy during the day. Kate sleeps with her mother at night. What do you think is the cause of Kate's slow weight gain? Kate does not breastfeed often enough. Do you think Kate should be started on complementary feeds or infant formula since she is not gaining weight? Giving complementary feeds of infant formula should not be necessary. If Kate is breastfed more often during the day and night, at least 8 times in each 24 hours, then she should gain weight.